What inspired you to take on this role as executive director of the APF?
Was very, very fortunate to have a multitude of conversations with their co-founder, Desiree Lyon. In speaking with her several times, it became very clear that this is where my heart was.
What goals can you share that you have just for the APF in general and jumping into 2026 and beyond?
Number one is we will be.
Welcome to Rarely Discussed, an American Porphyria Foundation podcast with your hosts, Andrew McManaman
and Nicole Castellano.
We have porphyria, a rare disease. Rare diseases differ greatly but share many similarities in how they affect our lives.
Being rare can feel lonely and isolating, but we're stronger together. Join us in meaningful interviews with porphyria and rare disease experts and the patients and families impacted as we connect, learn, and heal together.
We'll talk diagnosis, treatment, pain, mental health, managing daily life, and everything rare. Today on Rarely Discussed, we're honored to welcome Thomas Pletkovich, the newly appointed Executive Director of the American Porphyria Foundation, with over 2 decades of leadership across rare disease pharmaceuticals, patient advocacy, and health policy. Thomas brings a powerful blend of industry expertise and personal purpose to the APF. As a longtime advocate for underserved communities, Thomas joins us to share his vision for the APF's future, from enhancing education and advocacy programs to expanding drug access and accelerating research. We'll also explore his goals for 2026 and beyond, including fundraising efforts, donations, partnerships, and how this leadership aims to bring the porphyria community together like never before. Today's conversation dives into how his personal passions and professional experiences are shaping this new chapter for the APF. Welcome to the podcast, Tom. I appreciate you stepping on here with me.
Andrew, I feel very fortunate to spend the next 30 minutes with you. So thank you for the kind introduction.
Of course. And I wanted to, because of course you're the newly appointed executive director of the APF, and I wanted to just dive in head first and just get what inspired you to take on this role as executive director of the APF.
Well, actually, I was in the research-based pharmaceutical company industry for 3 decades, and I always said that there would come a point where I felt like I achieved what I could and needed to achieve in that 3+ decade career. And always in a career plan, wanted to spend time in a rare disease foundation nonprofit. And most recently, I spent the last 10 years with Pierre Fabre Pharmaceuticals, and they focus on rare diseases. And the rare disease I had the good fortune of spending time with was infantile hemangioma, and great career there, really enjoyed it. And so I did a bit of research. I'm a Sarasota resident, and through a Google search, I found Rare Disease Foundation based in Sarasota, and that was the American Porphyria Foundation. And was very, very fortunate to have a multitude of conversations with their co-founder, Desiree Lyon. And I think most that are listening to this podcast today, watching this podcast, know that Desiree is a force. And 44 years on the front line, Desiree has spent. And in speaking with her several times, it became very clear that this is where my heart was and where I wanted to be a part in meeting the unmet needs for patients and practitioners. And when the opportunity to lead the organization, and having had multiple conversations with board members back in November, accepted the offer and have been able to dive right in.
And I just want to give Desiree some credit. And I know in almost every episode, we always shed light on Desiree because she's the queen of porphyria. And I've said that a couple times because she's been such a driving force, like you said, with porphyria. And it's crazy when you have a conversation with her and you get the passion, and it's contagious. You have a conversation with her and you get that passion right away just from a conversation with her. But I wanted to dive into your experience a little bit and just talk about how, in your experience with rare disease pharmaceuticals, how it's prepared you a little bit more for this role as the APF. I mean, is it something that's just right in line, or was it something that's just brand new and was just has a little learning curve to it?
So I would say first is um, I've always been an empathetic individual, and when patients are dealing with rare disease, is you can't help but be empathetic. Is by the sheer nature of it being rare, so many times it can take years from diagnosis to our first symptoms to diagnosis, and we know with uh, of the 8 porphyrias, sometimes it can take upwards to 10 years before a first attack, a first symptom, before someone is accurately diagnosed. And having that empathy for patients and wanting to play an integral role of providing them as much education and as much support as possible. Andrew, the American Porphyria Foundation has over 10,000 patient members currently, which is certainly a significant a number of patients considering
Hmm.
it is a rare disease. And it's something that we are very proud of and stay in touch with these members through e-news and also newsletters on a quarterly basis. We also have a database of upwards of 7,000 physicians. A large majority of those have actually treated porphyrias in the past. So playing a role of providing support of patient education materials, helping to guide individuals to potential treating centers is something that I had experience in a past life, and certainly is a natural in this role with the APF.
And just to kind of dive deeper a little bit in that for a moment, because I know obviously empathy is something that you've carried from role to role to role. But what other lessons at some of the other companies that you worked for are helping you or are putting you in place to be able to tackle this new chapter with the APF?
So it is, and thank you for the question, Andrew. As you know, and we all know, is navigating the healthcare system is quite complex in the U.S. And moreover, one of the biggest challenge that patients have, and especially patients with rare diseases, reimbursement can be a real challenge,
Hmm.
and in navigating the healthcare system, a real maze. And we have played a role in helping patients to obtain drug through prior authorization process, working and in helping them to enhance the probability that they can get their prescribed medications in a timely fashion. And also, there are situations where patients fall through the cracks. Maybe they have a gap in insurance coverage.
Hmm.
Maybe they're in between jobs. Uh, and maybe there's a significant challenge as far as what their annual income is. And there are patient assistance programs that most of the pharmaceutical companies in the rare disease space, and specifically drugs indicated for porphyrias, that can play an integral role in both copay assistance, so copay cards, and or if they qualify for the patient assistance program, which could actually provide drug at no charge.
And with that too, just with those obviously lessons that you're bringing over into this role, and how it's shaping the new chapter, just to kind of dive into the nitty gritty of it, is what is
Yeah.
what goals can you share that you have just for the APF in general and jumping into 2026 and beyond?
Thanks for that, Andrew. Number one is we will be conducting no less than 10 patient um, roundtables across the entire United States. And these will likely be in conjunction with pharmaceutical companies, number one. Number two is there will always be a clinician and most often a thought leader, a key opinion leader, treating physician that will help walk through the different porphyrias and uh, tips and methods to mitigate symptoms and real world suggestions, guidance on navigating the healthcare system, as I mentioned earlier, and improving quality of life and providing patient education materials at all 10 of these. And I might add, our first one is actually going to be in Oklahoma City on January the 31st. So we conducted a few last year, and due to the significant success that we saw, and most importantly, the patient feedback,
Mhm.
is we're making a concerted effort to do more of those in 2026.
And I mean, I just want to nail that home a little bit too, is the importance of doing these, is because a lot of people don't actually understand the true value of meeting other porphyria patients in person. And that's what I always try to reiterate to people is even if somebody's a state over, make the time to meet with them, because having somebody that you can relate with on that level is very important. And I bring this up on several podcast episodes, but being able to go to the uh, the Pamplona event for the Porphyria Associations last year, or was it the year before now? Time's flying. That I was able to meet a lot of porphyria patients for really the first time. And it was just mind blowing to be able to connect on that level, as if I had never met any of these people online, or a lot of them. I never met any of them in person. And
Mhm.
we connected so quickly. We went out to lunch together, we hung out all day. And that's what I want to reiterate with these roundtables, is not only to meet porphyria patients, but at the same time to be able to meet people in the pharmaceutical industry. Because as we know, as patients and just everybody that's in this space, is there's a huge gap between patients and pharma, and there's just this hate relationship. And I think these roundtables kind of try and bring this gap a little closer together, because it's easy to sit here when you're not getting insurance, you're not getting the medication, is just to shake the hand and say, I hate you, pharma. But after meeting in Pamplona, I was able to meet a lot of pharmaceutical reps that are down to earth human people that are passionate about helping people. And that's where I think, again, this roundtable is very important, to say the least.
Yeah, I'd like to touch, and thanks for sharing that. I'd like to touch on that. Is having had the benefit and being blessed with a career of 3 decades in the pharmaceutical industry, I can tell you that um, the amount of research and investment in from discovery of a molecule to bringing a drug to market can be anywhere from 10 to 15 years. And so in the rare disease space, it's typical to have patent protection for about 10 years. So, that company needs that 10 years to recoup their investment. And it, due to so much discussion around pharmaceutical pricing in the United States,
Hmm.
we've come a long way with pharmaceutical companies in recognizing the importance of copay assistance, which I mentioned earlier, with patient assistance programs. They have dedicated specialists that will work with physician offices on enhancing reimbursement. And also, they are very focused on contracting and providing rebates to the pharmacy benefit managers that manage the prescription benefit for the insurance companies. So, first of all, no one likes to be sick.
Mhm.
and and especially if you're a patient with porphyrias or a porphyria. And in addition, certainly the last thing you want to deal with are potential gaps in coverage, high copays, not having reimbursement. And we've seen significant strides made in those areas. And in addition, the amount of research that is ongoing for porphyrias is very significant, and very well likely in 2026 you'll see at least one compound FDA approved, which will meet the unmet needs for many patients, and a nice addition.
Yeah, and I wanted to just to kind of circle back to the roundtable aspect and creating that education, and just how it's obviously helped with that gap. It's creating education for people, but I wanted to get your thoughts on what the plan is to expand education and awareness initiatives for both the public, but for health professionals too going forward.
So thank you for that, because in addition to providing the requisite patient education in these roundtables, and you touched on it, it's invaluable to know that you're not the only one out there that is dealing with a porphyria. It can be very lonely, it can be very emotional, and having that support from other individuals and hearing their stories. And I know that hearing about the past successes of these roundtables and these educational formats is individuals exchange contact information, they're staying in touch with each other. And in a big piece of, and you touched on, on the physician side or the healthcare professional side, is diagnosis is diagnosis is everything. And it's not unusual that, for example, a primary care physician could have a 25, 30-year career. They
Hmm.
might have two or three patients in their entire career uh, that might have a porphyria, or at least a diagnosed porphyria. Are there patients that fall in the gaps? Absolutely. So one of our initiatives in 2026 are collaborating with some of the pharmaceutical companies on continuing education venues and continuing education formats, in the very reason of enhancing diagnosis or improving diagnosis. Because there are a significant amount of patients, and we know this, they could spend a decade plus before being diagnosed. And if one of these types of educational formats for physicians can play a role, because they do have a limited amount of knowledge just through medical school and through residency, is if this can play a role in diagnosing another patient, to however many in a practice, and getting them referred to specialists and getting them in those treatment centers, if this plays a role, this is a significant contribution by APF to the community, and one that we're committed to.
And with that said, too, just the education and awareness for healthcare professionals and things like that. Would you be able to touch on the resources obviously offered by the APF just for anybody? And I know we've talked about it in these podcast episodes a lot, but I truly believe that there's not. I mean, you can't say it too much. That's the thing, is when it
So
comes to
so
resources.
thank you. And having spent 2 entire days with Desiree, I can tell you that she fields multiple calls each day from clinicians that contact APF for as much information as that we can provide them. So they actually look to us as a resource, and we actually have a physician packet that we send out that talks about diagnosis, about testing, and I know this firsthand because I've sent out some of these packets. So, in fact, I've been here 8 weeks. A week has not gone by that we haven't sent out some type of packet. And usually there are multiple packets that are sent out, and it gives me an opportunity to recognize Paxton Cumming, and otherwise known as Pax. And Pax plays a role in managing our Facebook post. But in addition, he is very timely in getting those packets of educational materials to healthcare professionals. The moment he receives them, they're going out. And in addition, also patient education materials. So we have a pretty significant budget when it comes to mailings, and
Mhm.
donation dollars are hard at work in supporting those mailings that we send out every month and every day actually.
And with that being said, too, in regard to the donations, can you touch on why those are important and how they've directly impacted research, the patient programs, and the future of porphyria care in general?
Yeah. So um, again, just touching on supporting patients and practitioners with those materials. It's not an insignificant investment for us. And uh, member advisory boards, uh, these patient roundtables. We're fortunate in that we get significant contributions from pharmaceutical companies that are participating or have drugs to treat porphyrias. That being said, um, for us to continue our scope of having these types of offerings and providing the requisite support to these patients, donations play an integral role. And nothing would make us happier is to add uh, some additional colleagues to our organization. We're all sufficiently challenged, and uh, as you know firsthand,
Yeah.
we're a mighty group of a handful,
Hmm.
and we we're all, I guess, I would characterize us as Swiss Army knives. And Swiss
Uh-huh.
Army knife, we do a little bit of everything here, and we certainly could use another individual to bring on into the organization to balance the workload, so to say. But between helping in reimbursement, helping with early diagnosis, providing those key patient education materials, being a conduit of helping patients find the treatment centers and the treating physicians. Uh, that all takes money. And
Hmm.
for those that have given us money in the past, we are eternally grateful. And we are grateful for your trust in us, our support, and your future contributions. For those of you that have not given in the past, and you're giving consideration to a charity cause, a foundation cause, and one specifically that makes a profound impact on patients with a very difficult rare disease, I assure you that we are excellent stewards of your choice to give the APF.
And it's something to reiterate too, is just the aspect of donations. Is we think about how long it takes, the extreme end of diagnosing porphyria or rare disease in general. I mean, that 10 to 15 years, there's people that have lived decades and decades and decades without diagnosis just to figure out later in life that they have it. And these donations, of course, not only support all the different events and the mailings and the things like that for people, but like you said, just to nail home, is it supports the staff to be able to provide these materials in a timely manner, to where
Mhm.
people are, of course, not, sitting waiting. And there's that anxiety. I mean, when you're hit with something and you don't know the answer with it, and you're waiting on a diagnosis and you're going through all this test, and there's just that point in life where you feel like you're lost and you feel like nothing's going your way. And then, yeah, it all circles back to donations at the end of the day, because that in turn helps the whole process along greatly. So just to nail home all of that, and I know, of course, we touched on so many different resources, and we got the donations, we have the doctor packets and things like that. And I want to make sure that I reiterate that I'm putting links in the description to all these things from the
Thank you.
American Porphyria Foundation to ensure that everybody listening and watching has a direct line to be able to jump on to that. So I want to make sure I reiterate that too. But I wanted to ask you too, just to switch gears a little bit, is what really excites you most about the current landscape of porphyria research, or just the goals of the APF? Because I know we've touched on obviously what inspired you to take this role, the lessons you've pulled from different roles, but what really is making you jump out of bed in the morning to say APF, here we go?
Um, well, I don't need much more inspiration than porphyria patients, and having spoken to several porphyria patients at this time. And before I touch into that or touch on that, um, I'd be remiss if I didn't touch on Nicole Castigliano and my predecessor, who really played an integral role of paving the way for my future contributions to the organizations. She certainly was invaluable. She still is passionate about the work that we do at APF. And between the efforts of Desiree and the efforts of Nicole, I feel very fortunate. And they both are so collaborative that they've helped me immensely. So I should have touched on that at the beginning. I know we talked about Desiree, but Nicole, thank you. And uh, what gets me going and the juice is going, certainly the patients, certainly the opportunity of improving diagnosis, improving the pathways for cost effective medications and reimbursement and positive reimbursement. I get really excited with, even though this is a rare disease, we have well, I don't want to leave any company out, but I believe we have 5 companies that have active clinical trials going on, and those that even have drugs on the marketplace or in the marketplace. So I think when we look down the road 4, 5, 10 years from now, well, even within the next few months, but over the next 5, 10 year period of time, we're going to see even more targeted therapies that uh, unmet provide for unmet needs and improve quality of life and optimizing patient outcomes. So those two things combined uh, leads me to believe that APF's role will be even broader in the future.
And something that just made me think when you were talking is a little goes so far in this foundation, and not just with donations, but just the work and what people put forth to make a difference in this community. Because we, on one side, yes, this is a large organization in the sense that there's 4,000 patients under it, but in the broad scope, we are a small organization, and those little efforts, or what people think are little efforts, actually go extremely far. So I wanted to touch on that, and just talking about your drive to get out of bed in the morning to make these differences that go an extremely long way. But I wanted to ask you too. I know we're going to wrap up here in a minute, but I wanted to ask you, for somebody listening, watching, that maybe is just looking for some advice. Maybe they're a porphyria patient. Maybe there's somebody struggling. Maybe they're wanting to get involved. I mean, what advice would you have for somebody listening, watching right now?
A few things, and thank you for the question. Um, be relentless of being an advocate for yourself in the healthcare system. And if told no, and if you don't get the answer that you're looking for, that you think is going to play an integral role in your healthcare, um, you're CEO of your health, and being a tireless advocate for yourself is essential. And if you need help, APF is available throughout 365 days to help you. And ask as many questions as you can to your healthcare providers, to your insurer, to your employer. If you have gaps in coverage, talk to your employer. Look at other foundations that might augment the cost of your medications, and also research and ask your pharmacy about patient assistance programs or your physician. So relentless advocate for yourself, and ask questions, and um, and also be optimistic. And I know that probably sounds easier than in actuality it might be, but hope is on the horizon for many patients out there. And um, you know what? Your best days are ahead of you.
Mm-hmm. And I wanted to tack on a little bit to your questions is I want to encourage people because we have so many different Facebook groups for the Porphyria Foundation. I mean, we have a main one, we have one that breaks apart in all the different porphyrias. And I just want to encourage everybody listening, watching to jump in them and ask questions. I mean, on Facebook, you can post questions anonymously if you want, if that's something that you would rather do. But I would encourage you not to do that because you ask those questions, and although it may feel personal, there's a ton of people in that group that can relate to that exact situation. And when people can relate to it, people know who you are. That's where connections happen, and that's where you don't feel as alone. So, in terms of the questions aspect, hop in the Facebook group. Obviously,
Thank
contact
you.
the APF,
Yeah.
and just juggle those two and get your questions answered, and you're not going to be so alone. But I wanted to also ask you just before we wrap up here is there anything that maybe I didn't touch on that maybe you wanted to bring to light for the viewers and the listeners right now?
Um, my most important legacy are my two accomplished adult daughters and my three beautiful grandchildren that are 10, 6, and now 6 months old. And I'll be a grandfather for the fourth time in 2026. So, family and friends ultimately is what drives me. And I am blessed beyond imagine.
Well, congratulations on upcoming number 4. That's
Yes,
awesome.
thank you. We're very excited.
Well, I wanted to thank you obviously for taking the time to come on here. I know we've been really trying to do this and hop on and chat with each other, and
We
I'm
have.
glad we were able to make the time and chat about it. So,
Well, for our audience, the delay in this has nothing to do with Andrew. Uh, I would say that I've been a bit difficult with my calendar. So thank you for showing me grace, Andrew.
of course, and I appreciate you carving out the time. I know life is busy, and setting this time aside can be difficult. So I definitely appreciate and I'm grateful for your time.
Thank you. I look forward to continue collaborating.
Thank you for taking the time out of your day to listen to our podcast. If you enjoyed this episode, please share it with friends, family, or anyone who could benefit. And please don't forget to subscribe and leave a review on your preferred platform. It helps us spread awareness, and we would be extremely grateful. You can also follow Rarely Discussed on Instagram, YouTube, as well as TikTok. If you're someone seeking diagnosis for porphyria, visit porphyriafoundation.org to receive a free doctor packet, forms for free DNA testing, and a list of doctors in your area. Stay tuned for more episodes of Rarely Discussed.